To ED or not to ED? That is the question. Emergency room. Noun. A hospital department providing immediate treatment for acute illness and trauma. The emergency department will provide medical care to any patient, regardless of age, prior medical history, race, or socioeconomic status. Emergency room physicians have a moral obligation to serve any patient that walks through the doors of the emergency room. A federal law which states a patient cannot be denied medical care due to their inability to pay also enforces this. The emergency department is open 24 hours a day, 365 days a year. As the number of emergency room visits has increased steadily since 2001, the number of emergency departments has decreased. 92% of emergency visits needed care within 1 minute to 2 hours. 2/3 of emergency room visits occur after business hours, on weekends or holidays.
Hey girls, so you wouldn't believe what kept me here so late last night.
What?
I had a 22-year-old meathead come in complaining of chest pain after bench pressing 300 pounds at the gym.
So what'd you do?
Well, we got EKGs and troponins. Everything was negative. He was normal sinus rhythm. And then I came back later and he was arm wrestling with his buddy out in the lobby.
Typical.
So what happened?
If you have chest pain that is accompanied by discomfort only after you swallow or eat, and if you have a feeling of fullness or burning in your upper abdomen, your pain may be from an irritation of the lining of the stomach called gastritis. This is not an emergency. You should make an appointment with your primary care provider as soon as possible. If you have fever, chills, or a cough accompanied by mucus that is green, yellow, or tan in color and are experiencing shortness of breath, you may have a lung infection known as pneumonia and should see your primary healthcare provider right away. If you have these symptoms and are elderly or have significant medical conditions, or if a child under the age of 1 is having these symptoms, we recommend you go to the emergency department. If you have any symptoms of crushing chest pain, squeezing pain in your chest, pain in the left upper arm, sweating, nausea, or severe shortness of breath, you may be experiencing a heart attack or myocardial infarction. If you are a woman, you may have different symptoms, such as abdominal pain, lightheadedness, back pain, jaw pain, or extreme fatigue. This is a medical emergency and requires acute medical care. If you have chest pain that is sudden and intense and feels like a sharp, ripping, or tearing sensation down your back, you may be experiencing an aortic dissection, which is when the lining of your aorta, the largest blood vessel in the body, is torn. This is a medical emergency. It is a life-threatening condition requiring immediate treatment. Go to the emergency room. Remember that chest pain is relatively unlikely to represent a dangerous cardiac disorder if either of the following are true. The pain changes with changes in body position, the pain is momentary, or if you have had similar episodes of pain in the past and a cardiac disorder was ruled out. For those cases, be sure to visit your primary care doctor for further medical management before seeking care in an emergency department.
Hey guys, I'm sorry I'm late. I had some BS to deal with.
No, really. What?
No, I'm serious actually, and I'm glad you guys finished lunch already because this is kind of gross. But anyway, I had a lady who just came in. I just finished up with her, and she started off by saying, well, 6 months ago. You know how much that drives me crazy. You know, it's an emergency room. Why are you here right now, today, right? So anyway, she has abdominal pain, 3 out of 10, and she just actually went to Mayo Clinic a week ago for a full workup. Her primary didn't find anything wrong with her. Mayo didn't find anything wrong with her, but she's convinced it's intestinal blockage. So she came here for a second opinion, and I did a full workup on her. I made sure it wasn't an acute abdomen. We did a full physical exam. Not appendicitis. And she's not happy with the diagnosis of IBS, which is what Mayo gave her as well. So
what does she want?
I feel bad for her. I know she's frustrated, but how do we teach our patients to use the ED properly without abusing the resources we have?
Every day, same story.
I know. According to the Centers for Disease Control and Prevention, abdominal pain is the single most common reason that American patients visit the ER, accounting for 7 million visits per year. Healthcare providers can work with their patients in helping them be knowledgeable about the quality of abdominal pain they're experiencing, significance of duration and onset, as well as associated symptoms in order to seek the appropriate care. For example, if you are a pregnant female with abdominal pain that is severe, constant, and knife-like, and is associated with severe cramping and vaginal bleeding, you may have an ectopic pregnancy and need to go to the ER immediately. If you develop a fever, your abdomen is tender to the touch, and you witness bright red blood in your stools, or your stools seem darker than usual, or you begin vomiting blood, you may have a ruptured appendix. You must go to the ER. If you experience abdominal pain that is severe, constant, and knife-like, and is associated with severe cramping after a fatty meal on the right side of your abdomen, you may have developed a gallstone. You should see your primary care doctor. If you experience watery diarrhea, fever, muscle aches, chills, nausea, or vomiting, gastroenteritis is the likely culprit. Gastroenteritis is a virus that will not respond to antibiotics and will reduce your ability to respond to antibiotics should you need them in the future. Call your doctor if the diarrhea, nausea, and vomiting last longer than 2 days, but adequate hydration and fever reduction with Tylenol or aspirin will suffice as the virus runs its course. Hey, it's a long day. You guys ready to eat? Want to go get some food?
Eat?
Yeah.
My day just started. I have a 19-year-old kid brought in by his roommate, completely disoriented, headaches, whole thing, wandering naked around his dorm.
Any alcohol?
Utax negative.
So no drugs.
No drugs. His roommate gave a history of him having headaches, a stiff neck, which he thought was from just exercising or sleeping wrong. He's had fever. He just didn't want to go to the doctor because he has finals, but he hasn't been able to function at all.
So what are you thinking? Just like the flu or the cold?
So we actually
that's
did
a
a
little more
lumbar puncture,
serious.
my first lumbar puncture.
Nice.
So poor kid has meningitis. Finally a zebra. Do you have a cold, the flu, or meningitis? How do you know what you have and when to seek medical care? Colds are usually not serious and can be treated at home. Symptoms may last 4 to 14 days and include a runny nose or sneezing, coughing, a sore throat, head and body aches, a low fever less than 101 degrees Fahrenheit, congestion of the ears, nose, throat, or head. Cases of the flu usually occur between December and March. Symptoms last 3 to 4 days, and a cough may linger for 3 weeks. Gastrointestinal symptoms are rare, but other symptoms of the flu include a rapid onset of symptoms, such as a high fever greater than 101 degrees Fahrenheit, severe body aches or headaches, a dry cough, extreme fatigue, chills, nausea, or vomiting. Meningitis is a life-threatening condition that requires immediate medical care. If you experience any symptoms of high fever, sudden headache with mental status changes such as agitation or confusion, neck or back stiffness, rash on any part of the body such as your armpits, groin, or ankles, please go to the emergency room immediately.
Disclaimer. Do not be discouraged from seeking medical attention if there is a true emergency. If uncertain if an emergency exists or not, call your family's primary care physician. If you cannot get a hold of your physician, please proceed to the emergency room or call 911.